Well, good evening, everyone. My name is Wendy Fletcher. I work here at Renison as its president. This is a really lovely occasion in the story of Renison, because in the event this evening, we're bringing together threads that Renison understands to be true. Those are the threads of the mind and of the lived experience. Ideas and praxis in conversation with each other as a vehicle for imagining a society where structures and systems are more able to sustain a quality of life for all of our citizens. It is such a delight for me to have the privilege of introducing our speaker today. I had not met Deputy Minister Janet Menard until this afternoon. We've had only a short time together, but I have to say, even though she graduated in 1975, her presentation, her person is so resonant with the kind of heart, mind, and energy that comes and joins the social development study program today. A deeply rooted conviction that with courage and vision enough, things will change. And she comes to us with that same spirit that so many of our students share, but on a different chapter, in a different chapter of that part of the conversation, after several decades of taking her hope and her courage out into the world and living it daily for change that is very measurable. So she comes today to talk to us from the wisdom, that place of wisdom and experience that she has accumulated. And I am entirely confident that in her words, we will hear not only wisdom, but inspiration for carrying forward into this next new generation of social change agents. An imagination for a very new and very constructive best becoming for all of us. So Janet, as I've said, was here some time ago. She graduated from the University of Waterloo and Renison in 1975. And as we were just discussing as we sat here, any of you that remember 1975 or have read this story, which is the history of Renison, will realize that the 1970s were an amazing change time. They were a day, a student era, where new ideas and perspective bumped up against authority structures and systems in ways that caused cataclysmic change, but change that broke things open in really new ways. So she comes to us from the location of that experience, and we're going to acknowledge and honor her very shortly on our Founders Day. She is going to be honored as our Distinguished Alumna for what she's contributed, and we're all hoping that on that occasion we'll actually hear something about those days, if not tonight. After graduating, with a Bachelor of Arts in Applied Social Sciences, Janet Menard began her work within the social services as a parental support worker, welfare worker, and youth worker with the municipality of Metropolitan Toronto. From 1985 to 2001, Deputy Minister Menard worked as a supervisor and later Director of Income and Employment Services with the regional municipality of Halton. Working with the Ministry of Community and Social Services, she served as the Implementation Manager and Municipal Change Management Coordinator of the Ontario Government's Business Transformation Project, which was responsible for the development of province-wide technology, service delivery model, and business change processes to support the Ontario Works and Ontario Disability Support programs. She held a series of high-level positions within the regional municipality of Peel, including Director of Ontario Works, Executive Director of Transition and Integration, and Commissioner of Human Services. As of 2015, Deputy Minister Menard has served as Deputy Minister to both the Ministry of Community and Social Services and to the Minister responsible for poverty reduction, which oversees the operation of Development Services, Family Responsibility Office, Social Assistance, Ontario Works and ODSP, and Community Services, Violence Against Women, Human Trafficking, Aboriginal Health and Wellness, and Gender-Based Violence. She's not busy at all. Deputy Minister Menard co-chaired Peel's Poverty Prevention Steering Committee, served as founding co-chair of the Peel Newcomer Strategy Group, and is a past president of the Ontario Municipal Social Services Association, Ontario Nonprofit Housing Association, Canadian Mental Health Association, Supportive Housing in Peel, and the Halton Community Legal Clinic. She has co-chaired the Ontario Government Deputy Minister Social Policy Committee and led the Provincial Human Service System integration of affordable housing, social assistance and early learning, and childcare for 47 municipal and district administration systems manager. She has lived the ideas, and we can hardly wait to hear what she has to share from her experience. Please join me in welcoming Deputy Minister Menard.
Thank you, Wendy. I'm tired just hearing that. A long list of things that I've been involved in. It's great to be here. Thank you for coming out. I know you're all busy. You're in the middle of exams, so your time is appreciated. But I do value the opportunity to talk to you today. A couple of months ago, I spent time with public service staff who are participating in what we call a blockchain hackathon. Have you ever heard that term? No? Okay. 6 teams were actually chosen to work on wicked public policy challenges over an intensive 3-day period. One of the groups was working on how to protect Ontarians from payday lenders. Another group was working on how to set up a system where commercial fishermen could swap their quotas, trade their or sell their quotas. Another group was actually working on something similar around cap and trade. But to arrive at the solution, they combined policy, program, financial, technical, and data expertise, and often across a number of ministries. And of course, they were accompanied by technical experts who know blockchain technology. I was actually asked to go and speak on day 3 at the wrap-up of their challenge. They had to compete to be one of the 6 teams to be part of this hackathon. And so I thought I would spend some time with them, getting to know what they were doing and how they were making out over the course of those 3 days. I didn't want to go in and say words and not really understand what they had learned. So I joined them about a day and a half into the 3 days. And I was talking with the cap and trade team, and the energy was just off the roof. All the teams were situated on, high tables. They had flip charts, whiteboards. It was just incredible. And they were actually developing code. The tech folks were developing code as we sat there. And I asked the cap and trade team, I said, if you were working back in the way we do business, back at Queen's Park, in our traditional way, the way we work today, how long would it have taken you to get where you are today, a day and a half in? And they told me that what they had accomplished would have taken them several months, if not a year, to accomplish in the way that we traditionally do business. So I think that, and I was fiercely inspired by that, but I think that hackathon example actually gives us a glimpse into policy development for the future. So what I'd like to talk about is government. Of course, that's where social policy is developed. The pressure on us to change, why it isn't actually intuitive for us to do so, why I think leaders are important in this story, and how I think they have to be different if we're going to get there. And I actually think this applies to universities as well, and I'll talk a little bit more about that. We are under tremendous pressure to change how the public sector works, how we develop and implement public or social policy, and how we operationalize programs and change. And I know that universities and colleges have a role to play in helping us get there. With the exception of a short and very unsuccessful stint in the Roadhouse restaurant business, which is a story for another day, my career really has been in the public sector. As was mentioned, I was here over 40 years ago, and I've worked for various levels of government. A lot has changed in those 40-plus years in the world around us, but not enough has changed within government. We haven't kept pace. And that may also be the case with universities. Not so long ago, over the last year, myself and colleagues were involved in some consultations organized by Queen's University, their School of Social Policy, because they're wanting to know how their school fits into the university and also society. And they shared their results with us, but their conclusion in a nutshell was that both governments and universities continue to operate primarily through silos. We aren't integrated, and we don't integrate. And if we have time for questions, which I think we will, bring me back to maybe the conclusion that they reached, because they actually felt that it could have been written for any university in Ontario. So what are the nature of our pressures? Well, of course, the advancements in technology, social media, digital revolution have all changed our world, and we don't even know what the impacts of artificial intelligence and robotics will be. There's tremendous pressure, though, to catch up with the private sector, to provide services in similar ways, using apps, self-serve, management of one's own personal information. People want to have control over their information. There is pressure to be transparent, to be open as government, to share our data, to share the analysis of that data and the information that we use to make decisions, which I might note are with taxpayer dollars. There's pressure to involve other people, others, in solving tough problems. Most importantly, from my perspective, people with lived experience. Or lived experience, which is the term we use in my world, or people that just are going to benefit or use our services and programs. If we don't ask and listen to people with lived experience, we run the risk of basing our decisions on assumptions that are false. And I have seen this many times over the years, and I'll talk a little bit about that. But we also need to involve stakeholders, experts, academics, people in unrelated sectors. We're under pressure to evaluate, conduct research, understand return on investment, and to do so quickly. There's still going to be a place for RCTs and research, but we have to test things in small ways, adapt and build them out. We're starting to use to test proofs of concept and adapting them quickly, then scaling them up with increased speed. But that also reduces the risk of our making big mistakes. So we have to accept small failures. And this applies to both technology and policy, procedures, and process. So the pressure to integrate all components at the same time. Gone are the days when you develop a policy and throw it over to operations and then throw it over to IT. We don't have time for that approach to the development and implementation of policy. Like the hackathon was a great example. We're also under pressure to use predictive analytics to understand economic impact. For instance, of the increases of the impact rather of an increase to minimum wage and social assistance rates. We don't really know the economic impact if we raise social assistance rates. I'm pretty sure that the dollars we give people on social assistance go right back into the economy. But what does that mean? We're not in lockstep with departments of economics, and we should be. Using behavioral science insights, actuarial science is becoming more popular around the world, the science that they use in the insurance industry, and integrating our administrative data both across ministries but between governments. There's pressure to work across government to support people through their lifespan, rather than help them manage artificial transitions that are the result of government silos and boxes. In my world, we support adults who have a developmental disability, and the Ministry of Children and Youth supports children that have a developmental disability. Children can be going along extremely well, stabilized and in a good supportive environment. When they turn 18, or depending on when they leave school, it could be up to in their early 20s, they literally fall out of the child system and then have to get on a waiting list to get into the adult system, which is completely destabilizing, not to mention cruel. But we don't think that way. We don't think across lifespan. We think in terms of our programs. One of my big embarrassments recently, they hand out, if you're in Toronto, outside the subways, they hand out newspapers. And I usually take one. The news it's small and pithy, and you can see what's happening pretty quickly. In that magazine, or in that newspaper, Humber College was announcing the launch of a program called System Navigation. All proud that they now have a full-fledged program to help so that people can get trained on how to navigate health and social services systems. And I thought, what an embarrassment. We now are training people to navigate systems. The last time I checked, and I went back and checked, systems are a conglomeration of a number of parts, but they're intended to work together. And if you have to navigate our systems, we're doing something wrong. And there's also pressure to trust staff and use their expertise at multidisciplinary tables, to liberate them, if you will. Steve Jobs said, "We don't hire smart people so we can tell them what to do. We hire smart people so they can tell us what to do." And that's the mindset we have to adopt. So why is this important? Well, I would say because the status quo isn't working for us. People on social assistance, and I was there many, many years ago, are staying longer than ever. The average is 3 years on Ontario Works, 36 months. When I was a welfare worker on the front lines, it was 3 to 5 months. And Ontario Works is the program, for short-term support. ODSP is 10 years. That's a little bit more understandable because people have disabilities. 30% of children in families who grow up in an ODSP family end up on social assistance before age 25. If you come onto social assistance with or without a health issue, the very best you can hope for is that your health doesn't worsen. But the odds are it will. When we merged health and social assistance data for people with a developmental disability, we learned that many have very preventable diseases that we're not catching. We also learned that we don't pay attention to the reproductive health of women with a developmental disability. But when we looked at the data, we learned that they have as many pregnancies as women in the general population. Heavy-handed enforcement techniques in any program don't work. They actually have a perverse effect. Requiring applicants for social assistance to prove their inability to work, to verify their disability, creates and reinforces that mindset, rather than focusing on what is possible, rather than focusing on potential and what is necessary to get there. And of course, time is money, and if time wasted is money wasted. So the risk of not making use of the best use of our talent and resources exists. So why is change hard for us? Well, because we're traditional. In government, we operate, at least at the provincial level, within the Westminster model of government. So we have silos with ministers responsible on the political side, deputies responsible for representing their interests, and implementing the priorities of the government and keeping the ministry running. Excuse me. But we keep information to ourselves. We protect what is ours. We get approvals through the hierarchy of bureaucracy. Briefings, do you know what briefings are more about decks that we prepare and are actually cleansed to remove red flags. Some of the briefing decks that have come to me have gone through 7, 8, 10 people before they come to me. And I wonder what is left? Like, where's the good stuff if people are pulling things out before it gets to me? Emphasis is more on our roles and responsibilities and accountabilities than on the Ontarians who will be impacted by our decisions. We encourage staff to solve issues before they get escalated, rather than involving senior staff, senior leaders at the outset, and drawing on their expertise and their experience. We try and push things off the radar, if you will. We reward products, deliverables, rather than how people work with each other and how they develop their staff and their teams and impacts on people. And we communicate through others. Deputies communicate to ADMs. ADMs communicate to directors, directors to managers, managers to staff. We control the message. And we don't extend trust, not easily. There's an overemphasis on confidentiality, in my opinion, to a fault. We also don't admit mistakes, if you haven't noticed. We hide behind rules and legislation. And we speak through key messages. Key messages, that's the one thing that struck me when I came to the province. People give you the messages that you're supposed to deliver, and that doesn't work for me. And Q's and A's, questions and answers. We anticipate the question you're going to ask and then have an answer ready. But usually the answer to the question isn't even in the Q&A. So we communicate this way rather than through meaningful dialogue. So I believe that leaders are a key to getting us there. Our age-old systems aren't going to change easily, and we need people who are going to speak out, speak truth. My boss, the Secretary of Cabinet, says, speak truth to power. We need leaders who are courageous, accountable, and passionate, and who are relentless in modeling this behavior. In my opinion, and I love Stephen Covey's leading at the speed of trust, many of these concepts are in there with others, but I'm a big believer in creating high trust environments, extending trust. If we don't have trust between a minister's office and a deputy minister's office, there's untold wasted time going back and forth, and that's why you get all the sign-offs and everybody has to weigh in, because trust doesn't exist. So we need high trust environments. We need to talk straight, so to clarify, not to confuse. Respect and genuinely care about each other. Be comfortable. Leaders are comfortable being their authentic self and creating conditions where others can be their authentic self. I have so many people come to me, partly because we have a diversity mentorship program, so it's my obligation to mentor someone who is diverse. All of us do that, deputies and ADMs. But people come just for advice, and they say, how can I fit into the public sector if they come from perhaps another country, perhaps another vocation, the consulting world, the private sector, telecom. And I say, we don't want you to fit in. If you become like a stereotypical OPSer, Ontario Public Service servant, we miss the value that you bring. We need leaders who seek out different perspectives and actively embrace those differences because they understand the value of diversity. To ensure transparency, people who are open, clear about their intent, humble. I always say, you don't have to be the smartest person in the room. Leaders, good leaders, make sure they have the right people around the table, and then they bring the best out them. My one attempt at humor is to say that I'm rarely the smartest person in the room unless I'm alone. You have to laugh. But that's true. I would say the deputies that I work with are smart and clever, but we don't have to be the subject matter experts. Leaders acknowledge mistakes and they right wrongs. They start by listening, they're prepared to be influenced by others, and most importantly, by people that are impacted by our services. I recently heard one of my colleagues said she was invited to a health table, the Ministry of Health and Long-Term Care. They brought a parent in of a child who had very complex medical issues that started when the child was about 18 months. And they spent over an hour with that parent listening to her experience on the healthcare system and how the system could have done things differently to make her life and the life of her child easier. So listening to people who know what they're talking about, and certainly that's true with Indigenous people, people with a developmental disability, and our social assistance clients. Leaders are relentless in their courage to take opportunity to nudge people out of their comfort zones. They're disruptors, they're provocative. And I have to tell you, the Secretary of Cabinet, we had Black History Month, and I mean, it's everywhere, but we have a group in the OPS called Black OPSers. We call them the BOPSers. And our Secretary of Cabinet has acknowledged we have a problem with racism in the OPS. And he stands up in front of a General Assembly of 1,000 OPS employees, including the BOPSers, and talks about that. That, to me, is just an amazing leader. He's making people feel uncomfortable, but he's saying what is true. At the same time, leaders should be positive and hopeful. People who see opportunities everywhere are big thinkers. I love Armin Yalnizyan. Not sure if you follow her. She's an economist. I like her tweets, and she said recently, it's not cynics that move the needle. It's the big thinkers, and I agree with her. Most importantly, leaders challenge underlying assumptions. So back to my other examples. The assumption that women with a developmental disability aren't sexually active. The assumption that because someone with a developmental disability doesn't communicate a medical problem, there isn't one. The assumption that if people have a choice, between working or being on social assistance, they will choose the latter. The assumption that the poor aren't using the internet or mobile technology. We know they are in large numbers. And my favorite assumption, because I actually ascribe to this, is the one that drives our policies around early learning and childcare. It informs the early learning and childcare pedagogy. And the assumption is that children are capable, competent, curious, and rich in potential. And if we can create conditions where they feel they belong, where they're free to express themselves and be heard, where they're engaged in decisions that impact them, and where they have a sense of physical and mental well-being, all the conditions are there for success, for them to be successful. And the first time I heard the pedagogy described to me, because I work in the adult world, at the time I did, I thought, where did we lose hope as it relates to adults, as it relates to youth? Why don't those assumptions underlie our policies for youth and adults? And what would they look like if we believed that every person coming in for social assistance was capable, competent, curious, and rich in potential? I think very different. So these are the things that I think leaders have to bring to the table. And in so doing, they will make a difference. That's probably my purse. Who would be calling me? Just ignore it. Pretend this didn't happen. So when I was at Renison over 40 years ago, different opinions were not welcome. They were viewed as threats to the status quo. Raising something unpopular or contrary was discouraged. We did not take the time to understand what was behind those varying opinions. We didn't listen to each other, not very well. I certainly learned that there's a place for activism, but more importantly, change and tolerance for differences will happen through listening and dialogue, in my experience over time. But it also helped me decide where I wanted to sit in life. Did I want to exist in my very privileged comfort zone, or did I want to be one of those people who ask provocative questions and create a degree of disruption? Quite honestly, even in my short foray into the private sector, I got a completely different view of the private sector. When you own a business and everything costs you money, you look at efficiencies, you look at waste, you look at value add. And I came back to the public sector with that lens. Now, I don't want to leave you with the impression that government isn't changing and that we aren't doing good things. Because I am an optimist and actually see a lot of opportunity. We know the pressures and challenges that I've spoken about. We're putting pressure on ourselves. We know what it will take. We're having the very same discussions within government, with our staff, with management, with staff through the entire OPS. And I say these things to new staff. I say these things to people who aspire to be leaders within our organization and in the broader public sector. And to students at schools of social policy, which tends to be where I'm invited. And we're making progress, I think, in many, many areas. One of my heroes is Dr. Molly Soichet. If you don't know her, Google her. She's the chief scientist for Ontario. She's just an amazing young woman. She's bringing people from different disciplines from all over the world to treat cancer and to reverse blindness, and they're actually making progress. What they've decided is cancer can't be treated with the same, we use the same approach for everyone's cancer. What they're starting to do now is take cancer out of you. She says cancer is personal. So they're taking cancer out of you and then seeing how it responds to treatment, and then they'll treat you accordingly. The problem is cancer doesn't thrive outside of the human body. So these experts have now created conditions where cancer can thrive, and then they can test what works. But it's a completely different approach, using people who may not necessarily be from the health sector. She's my hero. We're also learning a lot from the insurance industry and employee assistance programs, EAP programs, and workers' compensation. If you think about it, they're all in the business of helping people get back to work if they're off the job, or stay on the job in the case of EAP. They might support you to stay on the job. Wonderful learnings from them. And what they have noted, that employees, 60% of employees go to the doctor just to get the note for their employer, and not because they think they need medical attention. So that's a wasted cost for our healthcare system, but it also medicalizes something, starts the process of medicalization, something that may not have needed a health intervention. And EAP, in EAP, they say every touch is either helpful or it's unhelpful when you interact with someone, and they have eliminated unhelpful touches. In our Family Responsibility Office, we have a long history of service issues. We're number one on the Ombudsman's list of problem areas. And I get copied on a lot of the messages. Our ADM sends messages like this back to people who have a bad service experience. She says, and I quote, "You have my attention. I apologize for your experience with Roe. This is not the service experience that we are striving for. Your example is helpful and will be used to inform the transformation that is currently taking place." That's unheard of in the public sector to talk. Have you ever received a letter like that from government? I haven't. And in our ministry, our leadership team for 2.5 years now, to break that, the messaging control from deputy to ADM to director, we are meeting as a leadership group every other month to discuss priorities of the ministry and decisions in our operations, and where our risks are and our opportunities. And we're merging years of social assistance data with Stats Canada data. And Nancy Matthews and I, the Deputy Minister responsible for children and youth, the cliff I talked about and the climb back in, we have committed to filling that gap so that children don't have a gap in service, so that they are supported at natural life transitions rather than transitions imposed by our systems. And really, it was a family member that drew my attention to the lost investment. I was sitting at a table with family members about housing, I think, and a parent told me, my child was totally stabilized through the school system and through their youth until they got to the adult system. Everything disappeared, and a child who was in a very good routine, she said, now my son sleeps till noon, watches TV till 5, cuts paper for an hour, has dinner, goes to bed, and repeats the cycle. And she said, when his name comes up on the waiting list, how can I ever get him back into the routine? So, seems to me we've lost a lot of the government investment that we put into those early years. And that, aside from it being totally unfair and cruel, that doesn't make sense. So I would say we are making good progress, but the immune system is strong, of organizations is strong. It fights to protect from the invasion of something foreign entering the body. And in my opinion, it's going to be leaders that we rely on to get us there. And they can't be faint of heart. So in conclusion, I would add that there's no greater privilege than being in a position to influence public policy, and in our case, social policy. It's a huge responsibility, but getting to good and impactful social policy will require courage, and it will require leadership. So I encourage you not to take the path of least resistance. There are many that do, and it will be a comfortable place, at least for the time being, until we get more people mobilized. I really encourage you to stand up, stand out, and push boundaries. If you choose leadership, and there's a great book about leadership and being a contract and an obligation by Vince Molinaro. If you choose leadership, that's wonderful. But even if you don't, each one of you can exhibit leadership behaviors. And I think I've given you lots of really good examples to think about and to act on. Most importantly, I believe, be humble, listen to others, and be prepared to be influenced. And having said that, I hope you choose public service. In my experience, nothing is better. So I wish you all much success. Thank you. Yeah, and I'm happy to take any questions. Yeah. Hi.
Folks who go up to the microphone at the middle, just so people listening at home could...
If I knew I had to go to the mic, I wouldn't have asked a question, right?
Hello. Do you receive any backlash because speaking out against the way that government typically runs or the current structure?
No, I think we all know there's a better way. It's not to say that anyone is doing anything wrong. We're all working fiercely hard, but we've found ourselves in tradition, and it's so hard to break. break out of tradition. So when I talk to people, I acknowledge their hard work, but this isn't their responsibility. It's not their fault. We make their life difficult for them. And if we're not leading, if I'm not leading, if I'm managing when I should be leading, then the talent gets pushed down in the organization. So, Steve Jobs' comment about liberating the talent, having smart people tell us what to do, is something I ascribe to, and I think people want that. I think they want the opportunity to weigh in and use their talent and their expertise in the right way, rather than, nobody is proud of a deck or a briefing note that never sees the light of day because it was irrelevant, because that's the way we do business. So I think people want to do the right things, and I think people feel inspired that we can break from tradition and do things that will make their lives more enjoyable. I think people love working in the OPS, but sometimes we had a secretary come in and she said to us, a past Secretary of Cabinet, and her advice was to us was, resist the temptation of self-import, or to view yourself as being of self-importance. I'm not quoting her exactly. We like to think that we're more important than we actually are, and that's where I think being humble helps a lot. Doesn't mean you can't be confident and know what you're talking about, but being prepared to be influenced and open, I think, is key. It's a great question, though. I know I take that risk. But people come up to me and say, thank you for saying that was a waste.
Okay, as somebody who's made a habit of speaking truth to power, it's real frustrating when the power isn't listening. So, in part, my question would be, how do we get those who are already in positions to make a difference to listen? And I don't mean just let you have your say, actually listen.
Yeah.
But also, to be healthy requires, if you have any idea of the social determinants of health, you look at income, employment status, housing status, ethnicity. These are all covered in different silos within governments and social service agencies.
Yeah.
So what's going to change for us to put the health of people as the priority, and not just, are we going to give them another $5 a month?
Yeah.
Which seems to be the increment that the government likes to give me. Because I've been on ODSP since before it was called ODSP. And I'm getting a little tired of it, and I'm getting a little old, and now with my second degree, I'm still stuck on it. So, look forward to your answer.
Thank you. You've got a lot of questions in there, and I don't disagree with anything that you have said. I think that the things I talked about, use of data, like the health data is there. It wasn't until we pulled it apart and compared health use with our social assistance data that we could see people are not getting better on social assistance. A recent report out of the University of Calgary recommended that if you want to improve health outcomes for Ontarians, don't put money into healthcare, put it into the social determinants of health. And that's the message that we as leaders are communicating to the decision makers, to our government. But we need people to stand tall. In our business, quite honestly, and I've been around for a long time, we've used anecdotes rather than evidence to support some of the decisions and assumptions, false assumptions. So I think it's a long road. Unfortunately, I mean, you know, we have elections. Unfortunately, I don't think the poverty and the poor is an election issue. I don't think it's a game changer. And I have to be careful because I'm nonpartisan, and but we're kind of going into close to the writ period where I'm not supposed to be commenting on anything of the government once the writ drops. But I have to say, I think the government in their budget, in our ministry, put billions of dollars into the budget to address some of the issues that you talked about, but it has gotten little, if any, attention. And as we talk about platforms, I think you're seeing more from the NDP, but it's not a game changer for politicians, in my view. So I think we have to keep plugging away. I believe there's a different way of operating the social assistance program, one that is based on potential, that doesn't require people to prove all the things that they can't do, and we'll start. I don't think that requires political decisions. I think those are changes we can make within the system. But I hear you, and I would say I'm equally as frustrated, but it doesn't let me off the hook because I do have some power and influence.
I actually don't want to ask a question now. I just want to make a comment that I think hopefully complements what you've been saying. All along your presentation, you referred to reading that you've done, learning that you've done, voices that you've listened to, mentors. And I just want to affirm that I think the leadership that we need in this generation is a leadership that is informed, is well-read. There's a lot of opinion. There's a lot of anecdote. That is not going to bring change. And we need critical thinkers who are willing to look at a range of data, a range of information, a range of resources. And it would be my concern that, you know, at the academic level, particularly, that we're encouraging learners to become critical thinkers of actual data and not just opinion that sounds good, feels good,
right,
but really doesn't actually sustain change. So I just want to say thank you for modeling that, because that's one thing about leadership that is a constant through the generations, is you need to be learned and a critical thinker. Thank you.
Well, thank you for your comments. I appreciate that. And you actually have reminded to bring the conversation back to the work that was done out of Queen's University in the policy school. Because after all their consultations and talking to people, students and experts, academics, what they realized is that the policy school has to be, social policy has to be throughout the entire university. It can't sit alone. So to your point, we need to know the economic impacts of an increase in minimum wage, we need to know the health savings for people. If we can even shorten their time on social assistance or of a pharma program, we need to have that. And unless your policy is integrated in those other, in the Ministry of Health, in economics, in finance, if the finance people aren't looking at social policies with a view to the return on investment, and the early years, I could go on and on, but social policy can't sit alone unless we make those connections to the rest of our environment. We will face the challenges, continue to face the challenges that my friend spoke of. So, but thank you for your observation and your confirmation. Thank you.
was really, really struck, not only by the complexity of your experience, but by a thread that runs through it, the thread that you pulled from your Renison days where it really wasn't okay to ask questions and to resist dominant culture or dominant perspective. But despite that, you took the questions, and that has really captured my imagination, because to have answers is hard, to speak questions is hard, but I can imagine at least trying to bring the question to voice on the journey toward change. So I'm going to take that with me, I think, as a beacon, that not only for an environment like ours, which I hope makes space in this day and age for questions, I hope, but I do entirely think not always. But that's a mantra that actually is one that one can use to break open doors and floors and ceilings in ways that will make space for all of us. I thank you for the example of your life and for your willingness to share not only your wisdom but your courage and the insight that you have had as a living illustration of how, with a voice, one changes. Thank you so very much.
Thank you so much.
Thank you all for coming. Please enjoy the remainder of the refreshments and take some time to meet Deputy Minister Menard before you leave. Thank you.